Hello everyone. Welcome to third episode of Muscle Factory Unfiltered. I am Tehsin Mullah, CEO of Muscle Factory, and I am thrilled to have you with us today. We have got something special lined up that you won't want to miss. Today, we are bringing together the world of fitness and medical science in a way that's both eye-opening and practical. Joining us is the incredible Dr. Adarsh Hegde, a top-notch clinical oncologist and a proud member of our Muscle Factory family. Dr. Hegde isn't just a medical expert. He's someone who truly understands the importance of fitness in our daily lives. Our fitness coach, the host and the founder at Muscle Factory, Mr. Luke Goodme, will be engaging in a dynamic conversation with Dr. Adarsh Hegde about busting some of the biggest fitness myths out there and covering the real truths about how exercise impacts your health, whether you are looking to enhance your fitness journey or simply get the facts straight. This episode is packed with insights and tips just for you. So, get comfortable, grab your protein shake and get ready for a fun and informative ride. Let's dive in.
Hello everyone, I am Luke again and welcome to another episode of Muscle Factory Unfiltered. Today we have a very special guest with me, that is Dr. Adarsh Hegde. Thank you, Doctor, for being on our episode.
Hi Luke, thanks for having me here.
Pleasure is all mine, Doctor. Let's straight away get to the podcast. So, Doctor, please tell us about yourself.
So, I am Dr. Adarsh Hegde. I am a clinical and radiation oncologist, currently associated with HCG Cancer Hospitals, Hubli.
Okay. So, what made you become a oncologist?
So, after completing my bachelor's in medicine, so we are usually at around the age of 24, we need to choose, what specialization we get into. And at that point of time, oncology was kind of an unexplored thing for all of us, being young. And not having accessible cancer care in towns nearby to our hometown was one of the reasons I decided to pick up oncology so that we could make services available to all the patients nearby.
There's a big question like, what is oncology for a lot of people? So, can you brief it out?
So, oncology is a science which deals with diagnosis and management of cancers.
Okay.
So, I keep seeing cancer patients on a daily basis.
Okay. So, why is the word cancer so scary? So, a lot of people after they hear the word cancer, they're so scared. Like, is it that serious? We should consider it, or it is only in the initial stages or in later stages? How is it?
So there is a common narrative actually wherein people say that cancer is a death sentence, but I think that's kind of a myth in this present era, wherein we today with the present advancements in oncology, we are even able to cure stage 4A diseases, wherein in the oligometastatic settings, we are able to cure up to stage 4A. So cancer is not a death sentence anymore and not something to be scared of. Yes, there are certain cancers which in advanced stages are not curable till date, but I think we have come a long way ahead.
Say, I'm a female, okay, and I have very early stage of breast cancer, like even before the stage 1, okay. So what would you prefer I do to prevent all the rest stages?
So in such scenarios, we have something called as screening modalities that we do, wherein for every woman aged 40 and above, we recommend yearly mammography. So that even if there is a tiny lump or something, it can be picked through this mammography and we can intervene ASAP.
Okay. So, and a lot of females in this, because of the lifestyle they're living, I don't know what is it, they complained about having lumps in their breast. Is it, or are those lumps cancerous, or how is it? And why are they in the first place there?
So all cancers of the breast present as lumps, but then all lumps are not cancerous is the dictum that we use. So there can be benign lumps like fibroadenoma and all. These are very benign lumps, so they don't metastasize basically. So they can be easily surgically removed and they won't cause any problems in the future. But then there are other kinds of lumps which are malignant. So that is what we term as breast cancer.
Okay. And for the mouth cancer and all, is tobacco the major reason, or is it because of tobacco and their genetics or their lifestyle?
So we classify the head and neck tumors as oral cavities under one category. Then we have something called as oropharynx and our larynx and hypopharynx, these regions, especially below, behind the tongue and in your neck. So oral cavity का जो cancers are there, these are mostly because of tobacco only and only tobacco. It can be oral tobacco or smoked tobacco. But when it comes to oropharynx, that is the part behind your tongue, so it can be linked directly to tobacco and also to HPV infections, HPV infections are also linked with cervical cancers in women. It's the same virus which can whose infection can cause cancers of the oropharynx and other parts of the pharynx as well.
Okay. And so coming to the fitness part, so a lot of talk about cancer till now. So coming to the fitness part, so I've seen a lot of doctors not suggesting their patients to go to gym. What do you think the reason is? Is this because they don't believe in the trainers, or they don't believe in fitness?
To answer your question, I think one strata of people who are not very well aligned with fitness is, I would feel, is doctors again. I can't blame them too, because they are very busy with their schedules and have doing night duties, not sleeping properly, not eating properly. They hardly have time for themselves or family, and adding fitness is something which every doctor must do in their lifestyle. But I think unfortunately now people are getting aware, but then unfortunately a lot of them don't do. So yes, I think everybody should actually make time and prioritize fitness, and definitely suggest going to the gym, or at least mobilize yourself, do some cardio at least, or like some mobility exercises, stretching, for the least at least.
Okay.
Has to be done.
So coming to the commercial part of it, the dark side of our health and fitness industry. So end of the day, see, neither be me or any doctor or you, we do this is our bread and butter. Okay, we live the lifestyle. What we live is because of the money we generate in this. So how much can you trust a doctor in this? Say for example, it's not easy to become a doctor. You have to go through so many years of training. You have to spend so much money on your fees, the donations, the courses, the things you buy just to study and everything. Okay, so after that also, when you put a clinic, the equipments are like, I think in lakhs only they start. So considering all this, nobody, I don't think that if I would be in that place, I wouldn't just do it for the well-being. I would also look at the profitable side in this. So how much can you trust a doctor when it comes to this?
Definitely, today healthcare has become a healthcare industry. So definitely, it's definitely our bread and butter, as you said. So in the end, I think both in fitness or in medicine, there is something called as ethics, which you can't compromise in the end, wherein you have certain set of rules which you really cannot break, because in the end we both have to sleep in peace at night.
Sure, of course. That is the whole point of it.
So yes, definitely, and I also believe that something which is done for free does not carry much value, and a lot of quality is compromised in the name of cost cutting. So something which is cheap doesn't necessarily mean it is good, or something which is.
Yes.
I hope you agree with that.
Yeah, sure.
So to provide a certain level of quality and excellence, I think a nominal amount of fee can be charged when it comes to even medicine or any other industry.
Because recently I was talking to a friend of mine who is a doctor again. So he was telling me there is I don't want to take his name, XYZ person. The charge what usually is taken is like 50% of what is taken. He takes double of that. He was telling me the dark side of operation theaters, where for the names like doctors just sit inside. Most of the things are done by the ward boy or the nurse there. So, and a lot of movies also have come up. Say for example, where doctors show how bad the hospitals can be. How they can extract the money from the patients. So considering all this, is it how do I put it in right words? How do you break this banner? How do you break this, tagline where doctors, the end of the day, it is understandable because, you've done so much and you charge a
nominal amount.
Where
yes, true.
It is itna kaam ke liye itna hai bhai. This is how much.
Yes.
It is because of the equipments or the hospital charges or whatever XYZ. How do you put it in the right words to the patients?
So The age old, I think presently a lot of hospitals are also getting into marketing. But then the one thing which works for doctors even today is word of mouth publicity. If you
Yeah.
get well, you tell your friends,
Of
your
course.
family members, and then they come to me. That is how it works. And for that, I need to maintain a certain level of quality in my medical care that I provide. So I think word of mouth publicity is something by which a doctor progresses in his career.
Yeah.
And for that, I think he has to have that minimum level of excellence or quality.
And when you compare a regular patient versus a patient who's been into fitness, what are the key features you find differentiating?
So I will be able to speak more about cancer patients since I'm seeing them on a regular basis. And I have seen that people who indulge in a regular physical activity cope up with all forms of treatments, like for example, chemotherapy or radiation therapy, much better than the patients who have never been into fitness. Now, fitness can need not be going to the gym alone. So patients having at least moderate physical activity in their life versus compared with patients who are leading a very sedentary lifestyle, wherein they are sitting and doing all the jobs, not moving around, having a very poor diet. So these patients, they not only they are also at a higher risk of developing cancer compared to the ones who are having a better lifestyle and
Okay.
are into fitness.
So, for example, a lot of people don't like to come to gym. Okay, basically, the whole point of gym is strength training, weight training. Okay, nowadays we've got up all these different activities like functional training, circuit training, uh, different kind of group classes just to keep the clients, get them motivated, get them entertained in the gym. So, but the people who are into health, like fitness, but they do uh, just cardio like walking and running in the early mornings, is there a difference between these two people as well?
So when it comes to moderate intensity workouts like walking or brisk walking or swimming, cycling, I think these are all the bare minimum which every individual should be doing. And apart from that, I think strength training is very important for an individual because it definitely increases his strength and his ability to do certain tasks in day-to-day lives. And also mobility training is very important to keep your joints healthy.
Okay. So, and how do you think fitness has impacted the health industry? So comparative. So when nowadays, yeah, trainers are knowledgeable. They know what they're doing. So has it prevented? Is the patient count come down?
So the patient count hasn't come down exactly. I mean, we cannot really get an exact data for it. But then I think there are something called as modifiable risk factors when it comes to non-communicable diseases like diabetes, hypertension, or cancers, for example. And definitely adding fitness into the lifestyle will help in reducing the numbers, but it has to be incorporated along with other lifestyle changes, not just fitness. So fitness definitely maybe plays a 20 to 30% role, but along with that, having a good diet and avoiding alcohol or tobacco has to be the norm in our lifestyle.
So a lot of doctors say like uh, at least have some alcohol. So is it like is the doctor himself a drunkard or?
So even I was going through certain articles. Most of the articles, they are for lifestyle changes. When I was reading, it said, quit tobacco and limit alcohol use.
Oh, limit.
I
Don't
don't know why
stop.
they said don't stop, completely stop it. I don't know why they don't mention it like that, but they always say limit alcohol use.
So I came across a study recently. Okay, it was like even a single drop of alcohol is enough to kill a person. So the study was showing how alcohol changes the body, uh, how it enters the bloodstream, what happens, how the body functions. For some people, even a drop of alcohol is enough to kill a body. So when there is so much of there are few people who are dependent on it. They can't survive without it. So how are they living still?
So basically, what you are talking about, I think it's about hypersensitivity reaction. It's something similar to an allergy, for example. That is, for certain people who are allergic to probably alcohol may suffer from that. Otherwise, I think only addicts, it is a slow killer. Alcohol doesn't give instant death, but when taken orally, if you take somebody takes it, injects the alcohol into someone, then maybe it will kill him. But then when it is taken orally through mouth, it is a slow killer, slow poison,
Okay.
and slowly damages the liver and damages all other organs, multi-organ failure, and that's how a patient dies in the end.
So recently, so a very well-known celebrity called Hina Khan, she's diagnosed with breast cancer, and she's also been a very healthy person. She's always been in a good shape. She's always been exercising. She's always been in a very healthy lifestyle. You can say that. And she's got breast cancer. So what are your reviews on this?
So breast cancer is again a bit complicated disease. We call it a systemic disease as well. So in the sense, breast cancer has a lot of familial inheritance which can be possible. There is this gene called BRCA mutation, which can happen in particular individuals, and this can be transferred to the future generation. So that is one possibility. Other than that, there can be any other genetic mutations which could have happened. So fitness definitely plays 20 to 30% of it, but remaining 70%, it depends again on other risk factors which she might be exposed to. Like breast cancers also develop because of hormonal changes dependent on estrogen hormone. So hormonal imbalances can cause breast cancer. So there are various multiple reasons, especially for breast cancer and even ovarian cancers. They function slightly differently than the cancers of the mouth or the oral cavity that we usually see.
Oh, how has fitness played a role in preventing cancer?
So when a person is physically active and indulges himself in various fitness activities, this helps in hormone regulation of the body and also reduces the inflammatory processes that are happening. Along with that, it increases gut motility also. So thereby, whatever the carcinogens we usually ingest, their transit time in the gut reduces and it is excreted out of the body. All the toxins are removed out of the body. So that's how, when fitness taken as a lifestyle, it definitely helps in reducing the risk of cancer and helps in preventing cancer.
What is your perspective on bodybuilding? I mean, in the sense of proper bodybuilders like who take PEDs, like performance enhancement drugs, anabolics, growth hormones, and everything. What are your perspectives on them? So there are people who've used it. Say for example, there have been legendary bodybuilders who are still alive and who are still healthy. At when they were at their peak period of their bodybuilding career, they have used anabolics like I think water would be a nice term to use for it, and they're still doing fine, they're still healthy. Do you think it is just fate what has carried them, or is it also because of the lifestyle they've lived?
I think we are just seeing the tip of the iceberg here, wherein we do not know what has happened to so many other people who have not turned out to be celebrities. So usage of these enhancement drugs, probably it is really questionable the benefit it gives. So I would not recommend that to anybody unless it is done under very trained supervision.
So you've been a member of Muscle Factory. So what are your opinions regarding fitness? What are your recommendations? What is the message you would like to give out to the youth and the elderly of the community?
So I think I will be completing 1 year of my membership at Muscle Factory now in July, when July ends. So it has been a great journey for me, because when I was in a phase where I was changing jobs, actually moving from a different place to Hubli, and I was in the lookout for a good gym, and I stumbled upon Muscle Factory. And since then it has been a great journey actually. When I joined, like I was actually 72 kgs and I was in the worst shape. And when recently I saw my weight, it's around 65, which is pretty ideal for my height currently. So it's been a good journey actually. Especially the trainers have been very good, and they assist you in every step. Especially, also help me with diet planning, and they told me that yes, 40% effort what you put here, but 60% effort is what you put out there before you put something in your mouth.
Yeah, that is so true. So a lot of people have the problem of not controlling the taste buds. So it's so hard to resist tasty food, sweets. Um, what are the tips you would recommend for people to to have that that mindset where they avoid sugars and cravings for foods which is not actually required?
So I'll tell you one thing which I am trying by myself, but still it's difficult. Is what our mind is conditioned. For example, after every meal, you feel like having a dessert, and that's what is conditioned into us. And you start a meal with a starter, and then you end it with a dessert. So, and that's how we feel like after having a sweet or something in the end. So you just have to block your thought at least for the 10 minutes after your meal. Just resist it for 10 minutes, and you eventually forget about it.
Okay.
So yeah, don't get into the habit of having a sweet after the meal. Just resist it for 10 minutes and people can try it. Like
Could
it
also
works.
extend the insulin spiking.
Yes, yes. And again, insulin spikes are linked to cancers, mind you.
Oh, that also
Yes,
leads to
yes.
cancer. Okay. So when you get up in the morning, right, your insulin is always high. So what are the tips you would suggest in the early mornings so that you maintain your insulin?
So insulin and cortisol both have to be maintained. Two things, the high insulin levels and also cortisol levels are very important that we regulate them. So I would suggest is when you wake up in the morning, it's very good habit to have at least 1 or 2 glasses of water. And also to regulate your cortisol levels, please do not open your phones. I would tell everybody, do not open your phones because once you open your phone, you are loaded with so much information that your brain, goes into that stress level and the cortisol levels can increase and which is not good.
Okay.
Yeah.
Yeah. I'm also avoiding a lot of those things in the early morning these days. Because what used to happen is when I get up, no, I open the phone, I check who's come to the gym, I check the attendance record, I see the staff what they're doing. So I am trying to avoid that. And the reason I'm avoiding that is because I am loading myself with that early morning stress.
True.
I feel okay, what is going to happen? That gives me that negative feeling for the day. So I these days I'm noting it out that I get up in a very positive note. I get up, I look at the mirror and I smile.
That's
I
good.
smile, I make my brain program, okay, today is going to be a good day. And next, whatever happens, there is going to be, I'm going to look after it after my breakfast is done. So until that, I try to avoid my phone. I try to avoid all the screens. Sometimes I play music. And what would you recommend? Is it good to listen to good music in the morning?
Yes, it is good to listen to music, but avoid using earphones.
Okay.
Maybe you can play it on a speaker at a low volume, because earphones can actually again pass on a loud volume to your ears, and again they can cause some harm. Like it's not needed as a habit every morning, but definitely you can play some calm music, maybe do some breath work, which is a good habit.
So, doctor, so we are basically in the same age group, but the lifestyle what we live and the lifestyle what the generation this generation lives is, it's very bad to put it in straight words. It is really bad. So, a lot of people are into alcohol, drugs, late night parties and everything. What would you like to tell them, like what are the dark side of those things?
So these are all these habits, basically vices we call them, indulgences. They are like a black hole. People don't realize that when they start initially, maybe in their college days, people just let me just take a drag, or let me just try a sip of alcohol. That's how they started, and then eventually they start taking it once a week, then start taking it like twice a week, then they like I occasionally like they keep they start having events just to drink alcohol or to have smokes. There's no required need of an event there actually, but then they start doing that, and eventually they don't realize that they're addicts, and they don't even accept that they're addicts until it's very late. So my message would be, definitely alcohol or smoking is not cool. People associate it with being cool. I want to be a part of a group or something. I think it is not at all cool, and don't realize it when you're 30 or 40. Please realize it when you're in your teens or your early 20s.
Any last message you would like to convey to the people watching this podcast?
Well, to people, it's eat well, sleep well, stay fit, keep working out, and don't indulge in any vices. No tobacco, no alcohol, and no high sugary
Doctor,
diet.
it was great having you today.
Thanks for having me, Luke.
Thank you for the knowledge you've shared, and thank you for all the blunt answers you've given, which is really important, which a lot of people are scared to talk about. Where people are going to get them wrong, where they, कहाँ मेरे बारे में बुरा सोचेंगे. So the answers you've given is straight to the point, and it is what people need to hear these days. So thank you on that, and yeah, let's end this podcast here. Thank you everybody for watching this. I am sure you've had some good information.
So when I actually was in a lookout for a good gym in Hubli, I came across Muscle Factory, and then I met Tehseen first, and we had a discussion, and she showed me all the facilities and all, and through Tehseen I met Luke. And thereafter, you gave me the initial training, and thereafter we moved on to other trainers. I took the package where you guys assisted me, and it has been a great journey since then, and I will be continuing and meeting you again from Monday onwards again at the gym.
Thanks to Dr. Adarsh Hegde. He's been a great inspiration for a lot of young people. He's been a motivational speaker in a lot of colleges. He is also a very accomplished doctor in his field.